Hello and welcome to this video on Paper 2, Health and People, Theme 3. So remember we're looking at health thematically and this is the one about anatomy and surgery over time. The information in this video goes with what you should already have in your folders. You should have 3 revision sheets on this topic and the first one will look like this. As we're talking through it, remember that you could be highlighting, you could be adding extra details based on what I say around the outside, or you could even just be picking out some of the key words, key dates and writing them around the outside so they stand out a little bit more. Before you begin, it would be a really wise idea to do a black pen, red pen activity. This is just where you write down everything you can remember about this topic, all about anatomy and surgery in the 4 time periods listed below. And then at the end of the video, without looking at any of your notes, you can then have a go in a second colour writing down what you can now remember. This is really good for showing you how much you actually already know, and it's often not as much as people think it is when you've got no prompts whatsoever and you've just got to go from your memory. So pause the video here if you want to do this. Again, this is an optional activity, but could be a good idea for you to make some notes basically as you're watching this video. So you could take an A3 sheet of paper, divide it into the 4 time periods, put anatomy and surgery over time as a heading on there, and then you could then make some very brief notes on those 4 periods as we go through. Obviously, you don't need to write down everything because you've already got it on those information sheets printed for you. Okay, so let's make a start with thinking about surgery and anatomy in the medieval period. So first of all, in terms of their knowledge of the human body and of anatomy, it was pretty limited in this period. That's because most of their knowledge was based on the inaccurate dissections that were being done by Galen in basically the year 100. So even in the medieval period, which we're thinking about from the year 1000 onwards, it's still been almost 900 years since Galen was around. And they were still listening to his work, even though he actually dissected animals and not humans. He did have some knowledge of the human body because he'd worked in a gladiator school, but he obviously was basing most of it on his dissection of animals. And that led to some things that he got wrong. He also did make some general mistakes that weren't anything to do with animals as well. For instance, thinking that blood was actually produced in the liver and was something that was used as a fuel which was burnt up by the body and it would recreate it rather than the kind of correct ideas of the circulation of blood. So this didn't really change for a long time. People still listened to Galen for over 1,000 years because the Catholic Church didn't believe in dissection and they really pushed Galen's ideas. Remember that if you were a doctor, a physician in the medieval period, you would have gone to university and you'd be reading books that were written by Hippocrates and Galen. So people were very reluctant to go against the grain and try and do their own dissections in the medieval period. Now, generally, there were 3 massive problems as well with surgery in this period. There was the problem of pain, blood loss, and infection. And those aren't really solved until the 1800s and 1900s. So surgery in the medieval period was pretty dangerous. Now that meant that they didn't carry out very many operations outside of wartime. Often they did carry out things when they needed to during big battles, and there were lots of wars that went on in the medieval period, but most of the time they wouldn't bother with surgery, and there would be very minor surgery, if we can even really call it that was done by barber surgeons. So for instance, they do things like setting broken bones, removing teeth, and they did carry out some external surgery on problems like ulcers and eye cataracts. They did do occasionally some internal surgery like removing bladder stones, but generally it wasn't very advanced. And they didn't carry out very much surgery because of the high infection rate and the high death rate. Not that they understood at this point what infection was. So surgery was dangerous. It was only done as a last resort, and most of it was done by barber surgeons who weren't very well respected in this period. There were people like John Ardern who did try and make it more respected, but it wasn't really until really the 1700s that surgery became more respected as a profession. Pause the video here if you want to make any notes. Staying on this topic of medieval surgery, we're just going to think a little bit more about the impact of war that we've already mentioned. So there was some progress with surgery in this period, thanks to war. There were lots of different wars that happened in this period, including things like the 30 Years' War and the 100 Years' War as well. So during wartime, they did make some discoveries. For instance, Hugh of Lucca, who you might remember from lessons, actually discovered that wine was a mild antiseptic. Now, he didn't understand what an antiseptic was, something that basically tries to stop bacteria and prevent infection. But he did realise that soaking wounds in wine did lead to less people dying. So they did start to use things like alcohol as a mild antiseptic. They also did develop their use of painkillers. They used things like alcohol still, but they also used things like opium in the later medieval period, which they imported from places in the East. And they also made certain painkilling remedies that were made of things like opium and hemlock. And one of the people that created some of those remedies was the very famous English surgeon from Nottinghamshire, John Ardern, who had developed a painkilling ointment during the 100 Years' War made out of hemlock, opium and henbane, which he then wrote about in his book. So John Ardern is a really key individual to know about because he's basically one of the only successful medieval surgeons. He was somebody that didn't want to be known as a barber surgeon. He did lots of amazing work during wartime, and he wanted to try and change people's perception of barber surgeons. So he actually created something called the Guild of Surgeons in 1368, deliberately omitting that title of barber surgeon because he wanted there to be a difference and to be able to distinguish between barber surgeons and surgeons. And remember, he was very famous for his specialism of removing anal growths and having a survival rate of over 50%. So John Ardern, really key individual. They also did create some new technology during wartime as well to try and help with surgery. For instance, new tools like the arrow cup that was created to try and remove the serrated arrowheads much more carefully without doing more damage. And they also use things like the wound man diagram as well to try and help surgeons understand what kind of surgery to carry out and how to deal with different wounds that they might experience during wartime. So this is the end of the medieval surgery. Pause the video here if you want to add any notes on medieval understanding of anatomy and surgery. We're now going to be thinking about surgery during the Renaissance or early modern time period. Now, this is a really broad period starting around the 1450s and lasting to the end of the 1700s. Now, especially at the beginning of this period, there hadn't really been very much progress that had been made. Obviously, there had been some new things that had been created in the medieval period, like new painkillers and using things like wine as a mild antiseptic, but generally there were still the three problems that remained, and operations were still very dangerous and therefore didn't happen very often, still mostly happened during wartime. Now, Henry VIII did actually try and make surgery a more respected profession. Obviously, back in 1368, we had John Ardern who tried to create the Guild of Surgeons. And in 1540, Henry also had a go at trying to make surgery more respected by creating the Company of Barber Surgeons. And this, the idea behind this is that he wanted to try and maintain barber surgeon standards and control qualifications to the trade, because before this anybody could suggest that they were a surgeon, even if they hadn't actually been through an apprenticeship that most of them would have done. They could just claim to be one and operate on people. So they wanted there to be more regulations. Still on this topic of Renaissance surgery, early modern period surgery, we're now going to think about progress and why progress was made. So this is just some general points, and then we're going to think about some key individuals and how they helped make progress afterwards. So developments in surgery largely came from war, as there were lots of new weapons that were created in this early modern period. For instance, we have things like cannons that were created and also guns as well. So these new and more damaging weapons meant that surgeons had to learn to treat new injuries and also to work quickly. Now, they didn't really have any understanding of how to treat injuries from these weapons at first. When it comes to things like guns, they thought that bullets were basically poisonous. They didn't understand that they were often dirty and kind of drove infection into the body. So they used to do things to try and stop it being poisonous, like pouring burning hot oil onto those wounds. And thanks to Paré, they did eventually stop that. In terms of their knowledge of anatomy at the beginning of this period in the 1450s, there had been no progress since the medieval period. They were still very much relying on Galen and his dissection of animals. There did start to be some changes in the 1500s and 1600s thanks to Vesalius and Harvey, but it generally took quite a long time for people to accept this new work, go against the status quo of Galen, which people had believed for a very long time. In terms of where these kind of treatments and surgeries would take place, there were still lots of surgeries just taking place, on the battlefield, but also surgeries taking place in people's homes. But from the 1700s, we do start to get some surgery that starts to happen in some of the hospitals, as I'm sure you're already aware from doing theme 2. In the 1700s, there was this kind of hospital boom, lots more specialist hospitals set up, and more people were having surgery done in hospitals, although rich people in this period still had most of their surgeries performed at home. In the 1700s, at the end of this early modern period, there did also start to be some major changes when it came to surgery. For instance, the fact that they were creating the Company of Surgeons, which by the year 1800 got renamed to be the Royal College of Surgeons. So they're basically taking the work of John Ardern and Henry VIII in the 1540s, and they're starting to actually make it much more regulated by having this Company of Surgeons that we'll talk more about in a bit. So we're going to think about some of the key individuals that caused massive progress during this period. So we're going to think about key individuals, and this is going to be done over the next couple of slides, because there's 4 individuals that you need to know about: Vesalius, Paré, Hunter, and also Harvey as well. Now, if you're not sure about these individuals or you find it difficult to remember the details, the best thing you could do is to watch the BBC Teach video that's on YouTube. We've shown you it in lesson, but it's also on YouTube for you to watch as well. And if you're looking for it, all you've got to do is type in BBC Teach, Vesalius, Paré and Harvey, and you'll be able to watch that really good 5-minute summary that's really engaging about their work. So I'm just going to talk through briefly these key individuals and what did they do, and I've put them here in chronological order. So first of all, we've got about Vesalius, and he's really important to know about for his work on anatomy. Now, obviously we know that the Catholic Church was incredibly influential, particularly in the medieval period and in the early Renaissance period, before Henry VIII had created the Church of England to try and get his divorce from his first wife. The Catholic Church had been really powerful, and obviously the Catholic Church had banned dissections, but Vesalius decided to ignore this and decided to perform dissections himself. He was really interested in the human body and about different systems within animal and human bodies, and even as a child he'd been incredibly creepy and used to dissect animals, and he'd even done things like, when he was younger, stealing bodies to dissect at home. He then started more regularly finding the bodies of criminals who'd been executed and dissecting them, and then he wrote about his ideas in his book, a really important book called The Fabric of the Human Body. And this book contained amazing detailed diagrams of different systems within the body, including things like the digestive and reproductive systems. And all of this work is, one of the reasons why he's seen as kind of the founder of human anatomy. But it wasn't without its challenges. In the short term, when Vesalius was publishing this work, there was a lot of backlash. People thought either that Vesalius had done the dissections wrong, or that human bodies had changed since the time of Galen. people weren't accepting of his ideas at all and thought that maybe he was just dissecting people that were abnormal. So Vesalius did face a lot of criticism for his work, but he did an amazing job of eventually leading to people not listening to Galen when it came to anatomy. Thinking about a surgeon now, we have Paré, and Paré was a war surgeon who improved surgical techniques in the 1530s. Now remember, he was treating lots of gunshot wounds, and remember that they thought gunshot wounds were poisonous, and that's why they used to use burning hot oil to basically cauterize the wound and apparently stop the poison from spreading. Now, Paré had used the oil for a long time. One day he runs out of oil on the battlefield and instead decides that he's going to have to use some kind of other mixture to try and treat this gunshot wound. So he uses a herbal mixture with what he can find, including rose oil, egg yolks and turpentine. And basically he puts this on their wounds. He goes to sleep, and when he comes back, essentially all the people that have had oil poured on them have died from their injuries, but the people that have had this herbal mixture applied to their wounds have survived. So he realised how important that was, and eventually people stopped using oil on gunshot wounds. He also invented some other things as well, like he invented ligatures, basically as a way of trying to deal with blood loss. They would basically try and tie off the blood vessels. And this was an excellent idea, but there were a couple of things wrong with it. First of all, it took a long time to try and carry out this process of ligatures on a patient. And obviously they would be in a lot of pain, so they'd be moving around a lot, which made it very complicated. There's also another problem with this as well, and that is that at this point, you know, when we're thinking about the 1500s, Paré doesn't yet know about infection and about germs. So at this point, he's not doing things like washing his hands and sterilising things before he uses the ligatures, which means that a lot of people still die despite the fact that they're not dying of blood loss. So it's not until the later 1800s that ligatures become actually a really useful kind of invention, but it's still amazing that he created it then. He also designed some really effective artificial limbs, which are pretty impressive for the time period as well. So that's two of the key individuals that you need to know about. Pause the video here if you want to make notes on them. The last two individuals that you need to know about for the early modern and Renaissance period are Harvey and Hunter. So Harvey was somebody that was working on anatomy in the 1600s. He was technically a physician and he did lots of work on the heart, and he even wrote a really important book called On the Motion of the Heart, which included lots of very detailed diagrams of the heart and circulation of blood. And this was absolutely crucial because he was, like Vesalius, saying that Galen was wrong. He was one of the people that encouraged doctors and physicians to move away from the ideas of Galen and to start doing their own experiments and using the kind of power of observation rather than just relying on old inaccurate knowledge. But what's really crucial about Harvey's work is that eventually, when it starts to be accepted, it starts to change treatments as well, because previously the most common medieval treatment, and even in the Renaissance period up until the 1700s, the most common treatment is that people would go to a barber surgeon and have bloodletting done because they believed that their four humours were out of balance. But when Harvey does this work on the heart and the circulatory system, they prove that there isn't an excess of blood, and therefore that is a pointless treatment. So it leads to the end of that treatment and people looking for other ways to try and treat illnesses. And eventually, you know, from the 1900s, his work led to things like blood transfusions and complicated internal surgery. For instance, we wouldn't be able to have organ transplants without an understanding of the circulatory system, and that's obviously down to Harvey and some later scientists who have worked on it as well. The final individual to know about is John Hunter. Now, John Hunter was a British surgeon in the 1700s who had a really unrivaled knowledge of the human body, thanks to the fact that he dissected 2,000 bodies in 12 years. So he's really key for building on our understanding of anatomy, which then led to improvements in surgery as well. Now, he didn't just find out about human anatomy, he also introduced some new surgical techniques as well. For instance, in 1785, he found a new way to treat an aneurysm, which is a bulge in a blood vessel, by tying it off so it encouraged blood to flow through other vessels in the leg, which stopped the need for amputation. Now, that's really crucial in this period of the late 1700s, because remember, they still don't know about germs until the 1860s. So lots of people that had things like amputations with the dirty saws and dirty medical equipment would end up dying of that anyway. So he's basically saving quite a lot of people's lives through this one new surgical technique, although he did create others as well. Even today, he still has a museum that he created, and this is the John Hunter Museum in London, which involves a collection of over 3,000 preserved body parts and animals, which has been really important to our understanding of anatomy. But there's lots of questions about whether his work was very ethical. For instance, his museum collection involves or includes a body of a so-called technical giant, and that person didn't want to end up being dissected. And so some of John Hunter's work is controversial, but we can't deny the fact that Hunter has been responsible for a real improvement in our anatomical, oh God, I can't speak, improvement in our knowledge of anatomy. We're now going to think about the 1800s and what surgery was like in this time period. So at the beginning of this period, the three major problems of pain, blood loss and infection still remained, but there had been some major progress that was made from about the 1860s onwards. Now, generally in the 1800s, surgeons became more respected, and that is thanks to some of the earlier foundations of work laid by people like John Ardern and even Henry VIII. And obviously, we've talked about the 1745 Company of Surgeons, which they then renamed the Royal College of Surgeons in 1800. They wanted to try and regulate surgeons more to make sure that only people who were well trained could practice surgery, to try and improve the death rates and things like that. So the Royal College of Surgeons said that you could only practice surgery within 7 miles of London if you had a licence and if you belonged to that organisation. And over time, they introduced various other criteria that you had to meet in order to practice surgery, which seemed pretty sensible. For instance, in 1811, they introduced a new regulation that all surgeons had to attend at least one course in anatomy and one in surgery. So pretty basic, but all surgeons now had to actually learn something about the body and surgery before they could operate. They also said in 1813 that you needed to have at least 1 year's experience in a hospital before you could be a surgeon as well. So there have been some real progress made here over time with just making sure it was more regulated than before. However, as we know, there were still 3 major problems. Blood loss as a problem is not solved until the 1900s, and we'll look at that in a little bit. In terms of the problem of pain, they had made some progress in the early 1800s with things like using nitrous oxide, laughing gas, and they had things like ether as well as a form of a painkiller. Really, the kind of crucial discovery is made in 1847 when they find chloroform, thanks to the work of Simpson. We'll come back to that in a bit. In terms of the other problem of infection, there was major progress made during this time period, mainly thanks to Pasteur's germ theory, which he published in 1861, but generally wasn't listened to until about the 1880s. There were other people that had played a crucial role in trying to deal with the problem of infection. For instance, Semmelweis and also Nightingale also had a role in trying to deal with this problem of infection. So we're going to talk about some of those individuals in a little bit more detail over the next slide. So thinking about these key individuals, now we're going to talk through Simpson and Lister and their discoveries and their impact, which were absolutely crucial to the development of surgery. Now there's a video on YouTube, which is an excellent video to watch if you're a little bit unsure about these individuals or you are struggling to remember the details. And all you'd have to do is type in BBC Teach Simpson and Lister into YouTube, and you would find a really good 5-minute video that will tell you all about them. So let's first of all think about Simpson, because his discovery comes first in 1847. Now, as I already just mentioned, they did have some improved painkillers. They'd had things like opium since the late medieval period. They had things like hemlock and henbane. Then we have things like nitrous oxide in the early 1800s, and they had things like ether as well. None of those were perfect. For instance, things like opium, it was very easy to overdose, and many people died if doctors gave people too much. But there was also problems with ether, because ether often made people very sick, and it was also highly flammable, which wasn't ideal when most surgery is carried out at home in people's private houses next to the fires that people used to have in most of their rooms. So it wasn't ideal, and therefore James Simpson wanted to try and find a new painkilling ointment that would help women with the pain of childbirth. So the story goes that he invited some of his friends round to come and experiment with different chemicals and find out if any of them could be this new painkiller. And apparently someone knocked one over, and they all fell asleep, and they woke up later and they found that chloroform was an effective anaesthetic because it made the patients very sleepy and unconscious. Now that's really important, because now that they've got this effective painkiller and this effective anaesthetic, they can actually perform more complicated surgeries than ever before. They used to have to deal with people's limbs failing around, people trying to get up. Obviously, if people were in extreme pain, they found it very difficult to sit still. But now they could actually carry out these complicated internal surgeries because people were knocked out, essentially. However, it did take a long time for it to get accepted, although it was helped by people like Queen Victoria. So one of the reasons why people didn't like it at first is it was still difficult to get the dosage right. And there was actually a death of a young girl called Hannah Greener, who was only 15 years old when she died after having an operation on her toenail. And so obviously people were then worried that might happen to them as well if they use this new drug. But eventually Queen Victoria in 1853 used it during childbirth for her son, and she was basically a big supporter of the work of Simpson and chloroform, and she publicly called it blessed chloroform and said it was delightful beyond measure, which meant that more people were willing to accept it than before, because obviously if it was good enough for the Queen and she had the top doctors, then it would be good enough for other people as well. So this was a real positive step forward for surgery. However, it did cause problems as well. Because they didn't yet know about germs, they therefore carried out these more complicated internal surgeries, but then more people died as infections were driven into the body. So we sometimes talk about this being the so-called black period of surgery, because essentially in the short term, it led to more deaths because they were carrying out that more complicated surgery. So that's the first individual you need to know of Simpson. The other one you need to know about is Lister, and Lister is working on one of the first antiseptics. Now, remember that they didn't have any understanding about germs until Pasteur's germ theory in 1861. They had been using things like wine as a mild antiseptic since the medieval period, but they didn't understand why that helped less people die. They didn't understand infection generally, and they didn't believe in doing things like cleaning equipment that they were going to use for surgery. In fact, it was generally seen as being better if a surgeon was wearing a dirty apron, because people thought that that meant that that surgeon was more experienced, and they could see that experience in the unwashed apron. They also didn't believe in cleaning tools beforehand. They saw that as pointless, and they were like, well, if we're going to do it any time, it would surely be after we finished carrying out the surgery. Now, Lister had actually read Pasteur's germ theory in 1865, so only a few years after it was published by the French Pasteur. Now, he decided to believe what was in this report, even though many other people at this time didn't believe it, and they didn't believe that things like germs really existed, and they didn't believe things like germs that you could only see with a microscope could make something as large as a human ill. So Lister was one of the first kind of supporters of Pasteur, and obviously does some work in the 1860s. So he basically decided that infection was causing problems and wanted to try and find a chemical barrier to protect wounds from microbes. So in 1865, he tried something called carbolic acid that had actually been used previously to treat sewage. And because there was no regulations about how you could test medicines at this point, he decided to try it on a young boy called Jamie Greenlees, who's been run over by a cart. So Jamie Greenlees has had a damaged leg, and basically Lister decides to use his carbolic acid. He soaks the wound in it, he soaks the bandages that he uses in it, and he applies it, and this little boy heals. So he then realises this is a really important thing to try and stop wounds going bad and stop infections. So he started using it on bandages. He then started to try and make the whole process of surgery cleaner by doing things like using it on medical equipment. And in 1871, he even invented a spray that went all around the room, spraying carbolic acid. So basically, he was trying to create a sterile room, which obviously we know surgeons today use. And he did an amazing job of reducing the death rate of surgery from 46% to 15% in 3 years. And eventually, by the late 1880s, 1890s, it started to lead to aseptic or germ-free surgery, where they're not just trying to stop infection getting into the wounds, but they're trying to create a germ-free environment. And eventually they do things like steam sterilising equipment and doing things like wearing gloves as well. And all of that is down to the work of Lister, who obviously was very influenced by germ theory. So remember, there is that really good BBC Teach video on Simpson and Lister if you want to watch that. But now we're going to move on. We're now going to move on to the 1900s and think about the final problem that they had to solve of blood loss. So remember, there are 3 problems with surgery since the medieval period: pain, infection, and blood loss. Obviously, pain had been dealt with things like Simpson's chloroform that then evolved into kind of more modern anaesthetics later on. Then in terms of infection, obviously Lister and his carbolic acid led to aseptic surgery. So the last problem by the time we get to the 1900s is blood loss. Now, they had previously tried blood transfusions in the past, in the Renaissance period and in the 1800s, but they hadn't been successful. And that's because they didn't know about different blood groups until Landsteiner discovered these in 1901. Now, this was absolutely crucial that they understood there were different blood types, because now they could carry out blood transfusions that would work. Now, these were fantastic for solving the problem of people dying of horrific injuries, but also people could now have more surgery performed because they didn't have to worry about the loss of blood so much. However, it's not a perfect discovery, because even though they could now use blood transfusions, they needed the donor to be there then and there, because they couldn't store blood for any length of time. Basically, the blood would clot very quickly, and therefore it would be unusable after a very short space of time. That is until World War One, and obviously the need for trying to discover some kind of way to store blood when so many young men were dying on the battlefields in places like the Western Front. So a man called Albert Huston actually found that you could store blood by doing things like adding sodium citrate and glucose to the blood, which would then stop it from clotting for a little while. This then meant that soldiers could be taken from the battlefields to field hospitals close to the front line, and they could be given those life-saving blood transfusions, which helped save so many lives throughout World War One and World War Two. And remember, without blood transfusions, very few surgeries would be able to take place. We wouldn't be able to do very much for people that are involved in horrendous accidents if it wasn't for the importance of these blood transfusions. So the final problem of blood loss was basically solved, even though there's going to be improvements to this in the 1940s. Let's think generally about the impact of war on modern surgery. Now, if we're doing a 16-mark question on surgery, war is a factor you're definitely going to want to mention. Remember that war has been absolutely crucial in the medieval period with the wound man and the arrow cup and things like that. But there's also been a massive impact of war on Renaissance surgery as well. Remember, obviously, people like Paré were making those crucial discoveries during war, and during the 1800s, the Franco-Prussian War led to the development of germ theory as well. So war's been crucial in every time period, and it's just as important in the 1900s as well, with World War One and World War Two. So thinking about the impact of World War One on surgery, they were obviously having to deal with lots of new problems with the body as a result of new weapons. Obviously, they've had guns since the Renaissance period, but now they're having to deal with things like machine guns. They're also having to deal with problems like shells and all of the shrapnel that often came out of those shells, and also the new weapon of gas, which was used for the first time on a mass scale in World War One. So there had been some amazing discoveries made during the war. For instance, they now had transportable X-rays for the first time in World War One, so that surgeons could actually try and locate the bullets and shrapnel in soldiers' bodies to then be able to remove it. X-rays had been invented before the First World War, but they make them mobile during the First World War. Obviously, we talked about Huston already and how he found ways to stop blood clotting by adding sodium citrate and glucose to blood, which allowed for easier blood transfusions. And we also have the work of Harold Gillies as well, who is known as the first plastic surgeon. And this is because he worked on creating a special unit to try and transplant skin to men who had really severe facial injuries as a result of things like the shells. And he ended up treating over 5,000 servicemen by 1921. And he was absolutely crucial in kind of modernising surgery and being very experimental. You know, these things hadn't been done before. He was one of the first people to ever consider a patient's appearance when it came to surgery, and he was trying to make it so that soldiers felt more comfortable after the war, because some of them had some absolutely horrific injuries as a result of those weapons. In terms of World War II, there was kind of basically more progress and more development of what had been created in World War One. So, for instance, World War One, we've already mentioned about Huston and how he tried to stop blood clotting to allow blood transfusions. They basically learned some new things that they could add that meant that blood could be made fresher and usable for longer. So they're building on his work from 1914. But they also developed things like blood banks as well during World War II, where even civilians could actually donate blood that could then be used on the front line. And obviously blood banks and blood donations being used since World War II, and lots of your parents might have even been giving blood recently. We also have the work of the British surgeon Archibald Macindoe, and he was somebody that basically built on the work of his cousin Harold Gillies when it came to plastic surgery. So he was doing more plastic surgery, very innovative work, and he was basically doing this on disfigured airmen who had suffered a lot, particularly from burns during things like the Battle of Britain. And his patients were nicknamed the Guinea Pig Club because of his kind of experiments that he was performing on them to try and rebuild their faces after these horrendous injuries. During World War II as well, we also get the mass production of penicillin. And this had been created, or not created, sorry, but kind of discovered really by Fleming in 1928 when he published a report on it. But obviously he didn't know about the kind of the enormity of his discovery, basically, and the fact this would be able to save so many people's lives. Florey and Chain had done some work on it in the 1930s and had gone to the American government, who had given them $80 million to mass produce penicillin, and it's estimated to save the lives of over 15% of the wounded Allied soldiers. And obviously penicillin is very important for certain infections, but it's also very important to give people after any kind of surgery to prevent any infections happening. So penicillin, absolutely crucial, really important for surgery, and is mass produced during World War II. And they also had improved anaesthetics building on things like chloroform, which allowed patients to be unconscious for longer. Pause here if you want to make any notes about the impact of World War I or World War II on surgery. We're now on to the final slide of information. This is all about modern surgery post 1945. So generally, surgery today is very much reliant on technology. And obviously we use all kinds of new machines, which often rely on electricity. And this is a very basic thing, but the mass kind of use of electricity now allows us to build many more machines, which can be developed to assist surgeons. You know, even things like having heart rate monitors during surgery allows them to kind of understand the health of the patient and how the surgery is going. Even things like technology to mass produce certain things, like the development of plastics and things like steel, has even allowed us to have lots of different surgeries carried out regularly. For instance, we can do things like making artificial limbs and joints, that can be then used for replacement surgery as well. So there's been massive progress with surgery thanks to improvements with science and technology. I'm just going to talk about some of the examples of things that have really demonstrated the progress that has been made in the 20th century. For instance, we had lots of organ transplants. It's 1960, the first kidney transplant was carried out. We also have in 1967 the first heart transplant, and in 2008 the first full face transplant was carried out as well. So there's been major progress when it comes to things like organ transplants, especially thanks to the fact that we can have things like blood transfusions now, and we have a much better understanding of the human body and about things like organ rejection and about the importance of making sure that the donors are a good match as well. But we've also got some amazing changes in how we can perform surgery, not just what surgery can be performed. For instance, we have things like laser surgery now, and also keyhole surgery, which are a lot less invasive than traditional surgeries used to be. For instance, when it comes to keyhole surgery, we don't have to create large surgical cuts. We can make a very small incision. I say we, it's definitely not me, it's the surgeons. Surgeons can make a very small incision and can carry out surgery without very much damage to the body, which reduces things like recovery time. We can even use scanners to try and detect what is causing people to be ill, and to try and find out what surgeries would then need to take place without having to cut people open. So things like the CAT scanners and MRI scanners are absolutely crucial in then helping us to understand what surgeries need to be carried out. So modern surgery has really progressed in the last 100 years. The advancements that have been made are absolutely incredible, but some people would argue that these kind of foundations were really built in the mid-1800s. So it's up to you when you think the most progress was made between the 1800s and the 1900s, but we can't deny modern surgery has really progressed in the last 80 years or so. We've now come to the end of the knowledge notes. There's a few activities at the end here which I think would be really worthwhile doing. So first of all, hopefully you had a go at the black pen part of this activity at the start. What it would be a good idea to do now is, while it's fresh in your mind, without looking at your notes, to write down everything you can remember about their understanding of anatomy and surgery, key individuals, all that kind of stuff from those 4 time periods in a different coloured pen. And obviously, if you then are still struggling, what you could then do is look at your sheet and then add the bits that you have missed again in a 3rd colour. That will really help you understand what you need to work on. So pause the video here if you want to make any notes for the red pen, black pen activity part 2. If you're still not feeling that confident, it would be a really good idea to make some kind of detailed revision material, whether it is making a A3 summary sheet into those 4 time periods I mentioned at the beginning, or even turn it into a revision clock. If you are going to do a revision clock, these are the 12 headings that I would use. You could pause the video here to write those down, and then you could use the information sheet or the notes on this video to help you fill it out. The final thing is I've put on here the short answer test questions. Now I've broken it down into part 1, which is questions on medieval and early modern, and part 2, which is about the 1800s and the 1900s. So you could pause the video here and have a go at either writing down the answers to these questions, or you could just say them out loud, and then I'll have the answers on the next slide for you to be able to check whether you've got them correct or not. Remember, if it has a 3 in brackets, it means you want to put 3 different points down. Pause the video here if you do want to do that. And here are the answers to those first 12 questions. So you can pause the video here and see if you've got them correct, or if there are any that you struggled with, you could write down that information just to help you learn it in the future. So part 2, so this is the questions from the short answer test that are on the 1800s and 1900s. You can see you've got the next 12 questions here. So you can have a go at pausing it and trying to verbally or writing it down answer these questions. And finally, here are the part 2 answers for the 1800s and 1900s. Double check that you got these answers correct. And again, if there's any that you were missing, what you might want to do is go back and look at those sections again, because it might be that there's certain areas that you're struggling a little bit more with remembering. Well done for watching this video. Hopefully you feel a bit more confident. If you're not feeling confident, take some action to try and improve your confidence on this topic. Well done.